Now, the World Health Organization has doubled down on calls for a more equal distribution of COVID-19 vaccines. WHO's chief said that the least developed countries had to watch and wait while the richer countries spearheaded with their immunization programs. WHO's chief said that this vaccine nationalism might serve a short-term political goal, but they must support vaccine equity.
Coronavirus. At the time, vaccine nationalism might serve short-term political goals, but it's in every nation's own interest to support vaccine equity. I leave you with a challenge I set at the beginning of the week. Together, we must ensure that vaccination of health workers and older people is underway in all countries within the first 100 days of this year. We have 74 days left. Time is short, and the stakes could not be higher. Every moment counts.
The African Union has secured 270 million shots of coronavirus vaccine for the continent. The doses are expected to become available this year, but none have arrived yet. While in Europe, Asia and America, countries are well into their vaccination programs. The WHO earlier said that the world is on the brink of a catastrophic moral collapse and the price will be paid by people living in the poorest countries. The WHO chief urged countries around the world not to squander the window of opportunity that vaccines gave them to curb the spread of coronavirus. The WHO chief also criticized what he described as a growing divide between richer and poorer nations in the procurement of vaccines. The World Health Organization has continuously urged developed countries to give priority to low-income nations. Countries are facing dilemma over prioritizing vaccine needs, and many are securing billions of doses for its citizens first. Many reports suggest that vaccine nationalism will only slow the process of ending the coronavirus pandemic and will also hurt more nations economically. WION is now available in your country. Download the app now. Get all the news on the move.